Most people prepare for the situational judgment test by doing as many questions as possible. But doing as many questions as possible does not necessarily increase your score or ability to actively complete the test unless you understand the rationale behind it. The SJT test is not testing how much clinical knowledge that you currently have. It's not testing how much you can memorize answers. It's testing whether you act in the safest, most professional, and give the most proportionate response and actions to situations that you're likely to be presented with in your workplace. So in this video, I'll explain exactly what the situational judgment test actually assesses and how to approach both question types and the mistakes that could be costing you valuable marks. So welcome back. My name is George, a pharmacist, pharmacy leader and pharmacy educator. And I have a passion for helping the future generations of pharmacy and improving the pharmacy service we all provide. So if you're preparing for the Oriel situational judgment test coming up in a few months, then this video will give you a practical framework of how you should approach each of those questions and how best to prepare at this current moment. You'll be able to then apply this framework to every scenario that you incur. So make sure you stay to the end, as I'll be giving you a simple preparation strategy to turn those practice questions into genuine improvement opportunities. So first up is, what is the SJT? What is a situational judgment test? The situational judgment test tests how you would respond in realistic situations that could occur during your foundation year and beyond. It's designed to test professional judgment, not your specific clinical knowledge. The situational judgment test itself consists of 52 questions, and this will be delivered over 104 minutes. So it's roughly 2 minutes a question. And the scenarios presented in the SJT will cover a variety of clinical professional standards: patient safety, personal integrity, communication, teamwork, prioritization, managing mistakes, working within your competence, knowing how to seek support and when to seek support. The key to answering these questions is to make sure that you're answering from the perspective of a foundation trainee pharmacist. You are no longer a student in this situation, but you are also not an experienced, qualified pharmacist. So for every scenario, ask yourself, what can I appropriately do in this role, and where do I need support? As I mentioned, across the 52 questions, the questions are within 2 sections and are in 2 formats. The first is the ranking section. You'll be given a short intro to a scenario, then you'll be given 5 possible actions and asked to rank them in the most appropriate to the least appropriate option. And the second type of question within the SJT is a selection question, where you'll be given 8 possible actions and asked to select the 3 most appropriate. These formats test slightly different skills. As you've just seen, with ranking those 5 different actions, you have to compare the relative quality of each action, whereas with the selection question with the 8 possible actions, you are selecting the most appropriate overall. So before choosing your answer in any situation, make sure you've read it properly, the RTFQ, read the question, pause, and then identify what the question is alluding to. And from understanding the scenario, you should ask yourself, is there an immediate risk here? Is someone working beyond their competence? Is there a communication problem? Has a professional issue been raised? Or is the scenario testing how to prioritize? If you misunderstand the central issue, even a reasonable looking answer can seem the most appropriate. So, top tip, read the fucking question. Now, a framework to help you make the right decisions. To help you approach and answer these questions with some standardization, let's look at the SAFE framework. So, the SAFE framework, so remember this acronym, SAFE, with each letter being safety, act appropriately, find the facts, and escalate appropriately. So the SAFE framework: safety, act appropriately, find the facts, escalate proportionally. So starting off with the first letter, which was SAFE. Ask whether the patient, the colleague, the member of public is at risk. Is there any immediate safety concerns? The strongest response will normally take prompt action to reduce that risk. And safety takes priority over convenience, hierarchy, or avoiding uncomfortable situations. The second is act appropriately. Your response should be practical, professional, and within your competence. Avoid answers that involve doing nothing, but also avoid taking full responsibility. You are not qualified or authorized to do this. The strongest response usually involves taking responsibility for the initial action while seeking support where necessary. The third up was find the facts. Don't make accusations or significant decisions based on assumptions. Clarify what happened, speak privately with the appropriate person, review the relevant information, and listen before reaching a conclusion. However, the information gathering must not delay patient safety. And finally, escalate appropriately. Escalation is appropriate when there is immediate danger or when the matter is beyond your competence. Maybe an unsafe behaviour has been witnessed and demonstrated, or maybe the concern is a continuing one and has not been resolved yet. Maybe local procedures are needed to step in here. Maybe you need help with this one. But the escalation here and why it has to be appropriate must match the severity. It must be proportionate. Going direct to the most senior person for a minor inconvenience will be seen as excessive. Equally, trying to manage a major incident whilst being a foundation trainee pharmacist is unsafe. The best responses are proportionate. They escalate proportionally, not passive and not unrealistic at the time in your career. So how to answer ranking questions? For the ranking questions, let's start off by identifying the strongest and weakest action. They're usually quite obvious. The strongest action will usually protect the patient, address the actual problem, remain within your competence, and will be communicated respectfully, clearly, and concisely. And it will also probably involve some escalation and support where you need, whereas the weakest action will often ignore the problem, delay necessary action, act dishonestly, breach confidentiality, or even publicly criticize someone. In short, it will create further risks and issues. So once you have identified the two ends, you've eliminated some options and you can start comparing the remaining. So best, worst, three in the middle. Let's get into it. At this stage, the question to ask yourself is which is the next most appropriate action and why? Two actions may be both acceptable, but one will be more direct, one will be more proportionate, and one will be better at protecting the patient or person involved. Look at the wording closely. For example, speaking to a colleague in private is usually a better option than challenging them in public. And seeking support from the appropriate supervisor is usually better than immediately escalating to the most senior person that you're aware of. And taking prompt action is usually stronger than waiting to see whether the problem resolves itself. And if you are still unsure as to how to rank the middle, do not leave it unanswered. The ranking questions can award some credit when your order is close to the correct ranking. So make sure you complete and answer every ranking scenario. So now moving on to section 2 of the exam, where we have to select 3 out of the 8 actions that are most appropriate. And for each selection question, treat every possible action independently. They don't have to link. And asking ourselves a simple question here, would I actively choose any of these as part of my response? Remember, thinking about them mutually exclusively. So don't simply select an option because it's not obviously wrong, but it must be one of the top 3 things that you would do in this scenario. Out of your 3, a strong combination usually looks like an action that addresses safety, and that might be immediately. One action around communication and information gathering, and one action providing appropriate communication and escalation of the scenario. Maybe even a follow-up. But this does come with a caveat, as this isn't the most rigid of formulas. The correct combination will be dependent on the scenario presented, but this is a strong basis to go off of. Also be aware of looking for duplicated actions. You don't want to select the 2 duplicated actions, obviously, because one of them might be wrong. If 2 options achieve the same outcome, selecting both may add little value, particularly when other options address other elements of the scenario. So be cautious here. Another cautious tale here is to be aware of actions that sound sound too decisive and disproportionate, such as report immediately, refuse to be involved, tell the entire team. Those really strong, definitive words lean me to avoid the use of them. Another one is manage independently. These actions may sound confident, but confidence is not the same as competence or good professional judgment. So wrapping it up a little bit, here are 6 key principles to remember. That will help across every SJT scenario you come across. First off is safe. Every scenario that you use should be safe. Every action that you put across should be embedded with safety. The next one is private. Can we deal with the situation with some privacy? Can we maintain confidentiality? The next one is honest. Don't try and hide actions. Don't try and cover for someone else. We have a professional duty to be open, honest, and do the right thing. Next one. Make sure your answers are proportionate to the scenario that is being portrayed. We don't want to be escalating the most minor of issues to the most senior of person. The next one up is within your role. And that kind of links into working within your competence. Remember, you're a trainee pharmacist in these scenarios, so make sure you're acting as that person. And the final one is follow up. Can you follow up? Is there an option to follow up now, later, in a couple of weeks? Follow up with a senior. That is always key to make sure that the actions that you have taken are both maintained, sustained, and the outcome has been safe. And to cover all of this, this is all basically here to ensure the patient or person is safe. That is what we're here for. It is all around safe. It's all around safety. If someone is at immediate risk, address it before dealing with anything else, whether that be the long-term learning, reflection, escalation, or the administrative processes that come with some scenarios. So, first up on my board, safe. Patient safety, colleague safety always comes first. If someone is at immediate risk, address that before dealing with the long-term learning or administrative processes. The next up is private. Can we communicate privately? Can we maintain confidentiality? Can we be respectful? We want to avoid blaming, embarrassing, undermining any of our colleagues or patients. Number 3, honesty. Be honest. Don't conceal errors, falsify information, or avoid responsibility because disclosure feels uncomfortable. Number 4 is proportionate. Remain proportionate. Not every scenario demands formal escalation, but the serious concerns should not be minimized. Number 5 is work within your role, work within your competence. Seek support when you're uncertain, or when a task seems beyond your role, or when an independent action would be more risky. The next one is follow up, follow through. Weak responses come when we temporarily acknowledge the issue without ensuring it has been resolved. The strongest answers and the strongest actions combine the immediate actions with the appropriate follow-up. Now we've seen how to answer and the framework that which we should be applying, I thought I'd bring in some common mistakes that people make. First up is answering as an experienced pharmacist. Remember, within your role, within your competence. Second up is automatically selecting escalation. Escalation is not always the best first action. Consider if there's a safety issue or something else needs to be addressed first. Third up is the avoidance of difficult conversations. Speaking directly and respectfully to the person involved is often more appropriate than ignoring the issue or reporting it immediately. Fourth up is avoidance of that dramatic response. response. As we've already mentioned in this video, the strongest sounding answers can be definitive, but they may not be the most professional or the correct action. Look for safety, but make sure it's proportionate. The fifth up is not reading the question and not understanding what is going on. Can you rationalize what the scenario is going through and then understand the steps that are needed and the severity of those steps? You need to understand the why of the question before you can answer it. So now we know all the framework, but how can we best prepare today? So we've now gone through everything. Now I wanted to show you how I would prepare if I was you. So there are 3 stages when we're preparing for the SJTs, and I'll quickly write them down for you. Learn, practice, perform. Step 1, learn the principles. Learn the principles. Patient safety, professional behaviour, communication competence, proportionate escalation. Step 2, practice your reasoning. Practice your reasoning. Complete both question formats. Strict time pressures. Simulate the SJT environment. For every scenario, explain your strongest answer and why it is best. Then select your weakest answer and why it is the least appropriate. Then from there, we can start to perform under pressure. We're simulating the SJT. We're simulating the timed environment. We're performing under that pressure. Complete a full 52 time practice SJT. Become comfortable with making the clinical decisions at around that approximate 2 minutes per question. And then when we're going through the exam and you're checking it, review each question, what you've selected, and ask yourself, what is the central issue? What clue did I miss? What is the professional principle being tested here? Why was my preferred answer weaker? And then from this, you can build up what you do, why you do it, and you can see the patterns in that. Keep a log of the patterns that you repeatedly miss. For example, maybe you escalate too quickly. Maybe start acting on your competence as your confidence increases. Maybe you're not addressing the immediate risk, or maybe you're just avoiding that direct communication. And that is how you turn practice into progress. So that's all for this video. I hope you found it helpful. And if you do want some structured SJT practice, I have created some SJT resources that have both realistic scenarios and in-depth work through answers with both question formats and with detailed rationale in the answers. These will help you understand the rationale behind each answer, not simply firing more questions at you. You can download these resources at georgebond.co.uk. The link is in the description below. And remember, the SJT exam is not looking for perfection. It's looking for evidence that you can protect patients, behave professionally, communicate respectfully, and work within your competence. Use a SAFE framework and understand the principles behind each action in each scenario, and practice making decisions that are safe and expected of you as a foundation trainee pharmacist. In short, be safe, act proportionately, escalate when you need to, and find out the facts. If this video has helped you, like it, share it, subscribe. Good luck with your preparations, and I'll see you in the next video.